Good morning.
Good morning.
Okay, Doc, we've talked to you about so many different things. Obviously, GLP-1s, we've talked to you about different things. What is this? What is CoolTone?
CoolTone is a device that will tone, firm, and strengthen muscles using involuntary contraction with a technology called muscle magnetic stimulation. So the device will stimulate a muscle contraction that you can't achieve through exercise. It's the equivalent of doing thousands of crunches within a 30-minute span.
Okay, so obviously it's by the guys from Cool Sculpting. I see that right there.
Correct.
So Cool Sculpting, like you melt the fat.
You freeze the fat.
Freeze the
Correct.
fat. And then this, is it cold? Does it feel cold?
No. This is using magnetic muscle stimulation. You'll feel a little contraction, a little pressure, but it's not painful and it's not cold.
And you said you like this device for 3 different types of patients.
Sure. You have the aesthetic, the metabolic, and the functional components of this. So the aesthetic to improve that appearance with the increase in strength and tone. The metabolic, as we're losing weight, a lot of patients are losing muscle. This will help preserve some of that muscle.
Because if people are on like the Ozempic, Mounjaro, Wegovy,
it's a big problem.
They're
Correct.
losing a lot of fat, but then they don't know how to get the muscles back.
Not feeling tone, and this is one way to achieve that. Plus, we're able to kind of quantify that in body composition to make sure that muscle mass is not being lost.
Because you always say the one reason you're putting people on higher protein diets is to get some of that muscle.
Correct.
Because it works better.
So this is a nice adjunct to that.
And then the third reason you were talking about
functional components. Improving that core strength will help improve patients that have back pain, knee pain, just feeling stronger in the core is all beneficial.
Okay, so forgive me, I'm going to touch your tummy. Is it happening right now? Like, can I feel it? I can't really feel.
The first 2 minutes is really like a warm-up.
First 2 minutes is a warm-up. How many times would someone do this?
So usually 2 times a week for about 4 weeks is a good time to a predictable outcome.
And then, like, forgive me, she looks thin, right? And like healthy thin. Are her muscles going to pop out in a month?
She's going to feel stronger, toner. There'll be more visible muscle definition.
And then after that month, can she continue that with maybe a regular workout? Like, have the muscles been like woken up?
Sure. So there's studies that show 3 months after, without doing anything, those results are preserved. So typically with patients, they're all individualized as far as the next step. But usually, like you go to the gym routinely, maybe once a month, doing treatments for maintenance.
Okay, I love it. It's a great idea. We're all trying to look good. I'm just going to say it again. You're kind of a show-off because you already look adorable. Did you guys see her? But do you be the best mom you can be. And again, hello to Olga's mom. Thank you. And thank you.
You.
I mean, she's gorgeous, right?
She's doing great.
I'm just making sure. You have a mirror. You look cute. Okay, good. She was like, I hope I look okay. It's a great idea. Wait, is it working?
Yeah, you start to hear that sound a little bit.
I can